27. I'm going to be your nurse today before the doctor comes in. Let me just start out by washing my hands. Could you tell me what your name is and your date of birth?
Yes, it's Kara Marino, and my date of birth is 12/25/1994.
Great. So before we start, is there anything that you have that's concerning you or anything that you'd like to talk about?
I don't think so.
Great. Any allergies?
No.
No. Okay. So we're going to start by taking your vitals. I'm going to start with your temperature. So I'm going to take it orally. This is just going to go right up into your tongue. Beep, beep. Great. Your temperature is 99.1. That's pretty good. Okay. Now I'm going to take your pulse. Great. Your pulse is brisk and it's 78 beats per minute. Okay. Now I'm going to take your blood pressure.
I'll roll up my sleeve for you.
All right, thank you. Now, do you have any history of low blood pressure or high blood pressure that I should know about?
Nope.
Okay. All right. First, I'm going to see when your pulse diminishes, and then I'm going to add on to that to find out your blood pressure. Okay. Now I'm going to make sure the cuff is completely deflated. Great, your blood pressure was 110/72. Next, I'm going to listen to your respirations. I'm going to do this by listening and also watching your chest rise and fall. Great, your respiration is 16 breaths per minute, and your chest was rising and falling equally, bilateral. All right, so before we start into the next part, I'm just going to ask you a few questions. Do you know what year it is?
2020.
Great. Can you please tell me where we are?
We are in Massachusetts.
Great. And what did you have for breakfast?
I had eggs and bacon.
Good. Okay. So now I'm going to inspect your chest. So if you could just remove your gown a little bit so I can access it, that'd be great. Okay. So I'm going to listen to your heart right now. Your heart sounds great. There was no abnormal sounds. Okay. And do you have any trouble breathing at all?
Nope.
No? Okay. Do you take any medications for breathing?
No.
No. Okay, good. Okay. So now I'm going to assess your respirations. If you could take a couple deep breaths with your mouth open, that would be great. Great. Everything seems equally bilateral. Okay, so now I'm going to do your back. So if you could please just swing over a little bit, that'd be great. Okay, again, so a couple deep breaths with your mouth open. Great. Your expiration is greater than your inspiration. Everything sounds great. There's no abnormal sounds that I could hear. And your chest was moving bilaterally. Okay, so next I'm going to do your abdomen. And if you could just swing your legs around to lay back, that'd be great. Okay, so I'm going to look and listen. So first I'm going to listen for vowel sounds in all 4 quadrants. Great. Vowel sounds were heard. Reactive. And I'm just going to palpate. Let me know if you feel any tenderness. Okay. And I'm just going to check your skin. And everything looks good. There's no bruising or lesions or edema. Okay. If you just want to swing your legs around, we're all set. So a couple questions was, when was your last bowel movement?
This morning.
Great. And how often do you typically have them?
I would say at least once a day.
All right. It's pretty regular. Nothing to be concerned about?
No.
Okay. And do you have a problem going to the bathroom?
Not
When
usually.
you do go? Okay. Good. And how's your diet?
Pretty good. I usually like to eat 3 meals a day and 2 snacks.
Good.
I try to stick to a protein a day and a vegetable.
Okay. And are you on any diets?
No, not specifically.
Okay, good. And do you have any problems urinating when you go to the bathroom?
No.
No? All right. So now I'm just going to inspect your upper extremities. So everything looks equally bilateral. Your skin is intact. There's no pitting, bruising, edema. I'm just going to check your capillary refills. This is going to check for circulation. Okay. And they refill within 2 seconds. That is great. And there was no signs of clubbing when I looked at your fingers. And I'm just going to now check your pulses. Great. Your pulses are strong and equal. Now, may I please check your pulses in your wrists? Good. You have strong bilateral pulses. Okay, so now I'm going to assess your range of motion. Please tell me if you have any pain with doing these exercises, and we'll stop.
Okay.
Okay? So if you could please take your chin and touch your chest. Great. Now your chin to your right shoulder, chin to your left shoulder, cheek to your, or ear to your right shoulder, ear to your left shoulder. Could you please tilt your head all the way backwards for me? And now tilt your head all the way straight. Great. Now if you could put your hands out, I'm going to put a little resistance on it. Please restrain from the resistance. Great. Now if you want to flip your hands over, I'm going to push down. Don't let me push too hard. Great. So now I'm going to do your lower extremities. Again, I'm going to look for any abnormalities in your skin and temperature. I'm also going to check your pulses while I'm down here. Great. Awesome. Your pulses are strong and equal, and you have no skin lesions or bruising or anything like that. Now I'm going to do your range of motion in your feet. If you would like to flex your feet for me. Okay, and now push your feet down straight, point your toes. Great. And now I'm going to be like a gas pedal. If you could push your feet against my hands. Great. And now I would like you to lift your feet up, and I'm going to push down. Perfect. Do you have any trouble with your legs or your feet at all?
Nope.
Nope. Do you never feel any tingling sensation or anything upon that?
No.
Okay, great. So your lower extremities look great. Temperature was normal. There was nothing to be of concern. Okay. Now that I'm done, I was wondering if you had anything that you wanted to go over, any findings or anything before the doctor comes in.
No.
Okay, great. Wash. Have a great day.
Thank you. Yours was so much better than mine. Bye.